Good afternoon. I'm Ted Rumley, Chairman of the Dade County Commission, and we're back here today to give you an update. We have quite a bit to cover. Have several people here that's going to give you some informative information, and very informative. We have today we have Logan Boss here from Rome. He's with our public health out of our main office, and we appreciate him coming up today. A little later on, he'll be here. Today, we have 2,809 confirmed cases in Georgia. That's up from 2,651 yesterday. Three in Catoosa, 1 in Chattooga, 7 in Whitfield, 28 in Floyd, 15 in Gordon, 121 in Bartow. We have 87 deaths. That's up from 80 yesterday. That's 7 deaths in 24 hours. In Tennessee, they have 1,537 confirmed cases. That's up from 1,373 yesterday. Have 37 in Hamilton County, 5 in Marion, 2 in Grundy, 8 in Bradley County. In Jackson County, they have 5. In DeKalb County, they have 4 in Alabama. And totally in Alabama, they have 837 confirmed cases. That's up from 783 yesterday. The numbers just keep rising, and as we said before, they're going to keep going up and keep going up, and hopefully they'll level off here before too long. We've had a lot of calls since Saturday pertaining to Cloudland Canyon. I mentioned that yesterday, just kind of touched on it, but it's turned into be a big deal, and we feel it should be a big deal because it's amazing the people that came in there Saturday and even yesterday. And we're working with Senator Mullis is working on it as we speak with the governor and our parks commissioner, Mr. Williams. I did have a call from DNR, Mr. Walter Rabin. He's an assistant there, and he assured me that they're looking at different options. They didn't really say anything really positive about closing the park, but that could change between now and the weekend. So I'll keep you updated as we go every day on this because it is top of the chart right now. It's just kind of an artery coming into Dade County, with people. Most of those people, are kind of, I guess you would call it escaping, the actual city or the metro area down there coming in. And we had a lot of tremendous amount of cars out from out of state out there too. So we'll keep you updated on that. We don't have any confirmed cases in Dade County. That's a good thing as of yet. We had some of the people have got actually put it out, I think, online that we possibly have one, but we don't. We did transport one yesterday with some of the symptoms, but there's been a lot of people that's tested that's got symptoms. That don't mean we have a positive case because the symptoms are real close to having the flu. So, we'll update you the minute we know that we have a confirmed case. Hopefully that won't happen. Kathy Page, our Superior Court clerk, she wanted to be here today. She's not feeling very well, but not from the virus, but she's just not feeling good today. She just has an announcement or some announcements that Carrie is going to post online. It'll be on our website. And there are just some things that's changed about her office, about doing your business with her office through the window that we've got down there. That's going pretty smooth, going real smooth. And she mentioned that the deed room will be open to the public on a limited basis, and she only allows like one searcher at a time in there to be in there. It says during this period of limited office use, you may search the grantor or grantee indexes, and you can go on the website, which will be online there with us, and you can actually look at the deed index all the way back from 1984. You can pull up the liens also through that, and so there's some changes that that she wanted to go over with you, and that will be posted on our webpage. I want to thank a lady that we've had a lot of people call, and offer assistance and help. But Verenis Hawkins, if those of you that know Verenis, she's one of our health board members. She's making a mask, and she's offered masks for all of our employees here in the county, and so she's making homemade masks, and I'm sure that they're top notch if Rennis makes it, but I just want Rennis to know we do appreciate that. Let me see if there's anything else here. I want to give you our the email address for info@dadecounty-ga.gov. If you have any questions, go on that site. Also, call here at 706-657-HELP, and we'll be glad to help you. And my cell number is 423-667-8999. Most of you know that. We'll go ahead and have we got anyone from the schools here yet? Nope, no one here. Okay, Alex. Alex Case, he's our MA director, and also Mayor Trenton. Yep, Alex.
Good afternoon, everyone. I hope everybody had a well weekend and enjoyed some time with their family and at home. One of the things for emergency management, Georgia was declared a major disaster, and orders from the federal assistance supplement state and local recovery efforts in effect with the COVID-19 pandemic beginning January 20th, 2020 and continuing. What that accepts for us is, since we've stepped into this through the city and county, all of our efforts to provide personal protective equipment for our responders, our law enforcement, our transportation, our sanitation, and the transfer station where our gloves are used with all of our men, and other precautions we have taken has been a pretty large expense for us besides our day-to-day operations in EMS. And as a shortage of this stuff has come in, we've had to make emergency purchases for this, and also very limited strategic stockpile given out, where hospitals are the primary, clinics, and then EMS is third. Now, we have received some in, as I reported some last week, but we're looking at a longer threshold to do this. And also for our county to operate remotely like this, the expense for the windows, any procedures for getting people to work remotely from home with things that we have to do to keep our operations moving. Myself, Commissioner Rumley, Don Townsend, our clerk, and our deputy clerk CPA, Rebecca Jones, will be attending a mandatory meeting on this kickoff for these funding and reimbursements. This is what we've stepped into in every disaster that we've been in. Now, you can imagine 159 counties that is also going for these same things, and it's for life Category B emergency processes and procedures to sustain what we're trying to do. So documentation is what we'll be dealing with, but we're trying to make sure that, we can be the best stewards of the money that we have to do these measures, but we still got to continue to do day-to-day business, what impact this is going to work with us, so we can update city and county commission on what's going on with that. So we've already been documenting like crazy once the president declared this stuff, and it's just what we do here in emergency preparedness and emergency management. Again, everything is still day to day. We are taking several calls on a couple different businesses that are still open and that we are researching with, where certain counties and cities have actually restricted essential businesses to be open and closing other things. That is in discussion. We're trying to find some good leeway what's best for that, and we know that it is very hard to tell a business that they cannot do that. But I'd remind that we do have the SBA loans that we are approved through state of Georgia. You can go to the county website, look for SBA. It's toll free. They can help anyone that is struggling due to this for closing of the type of business that they are. These are there to help you. So if you have any questions, as all the numbers that were mentioned by Commissioner Rumley, again, thank you for what you do.
Okay, Logan, y'all want to come on up? And okay, of course we have Lindsay. I don't know which one wants to go first. I'll just take you.
Hello, I'm Lindsay Ryan with the Health Department. We really don't have any new information, but any new viewers, I'll just say, if you're a WIC client, if you need vouchers, call the health department, and if you already have an appointment scheduled, expect a phone call around that appointment time. Restaurants, the dining rooms are closed, but a lot of them are offering takeout. And then as far as social distancing, I mentioned last week, let's not wait until we get on the map with numbers in our county. Let's abide by the social distancing, good hand hygiene. If you feel like there's a business or someone that's not taking that serious, Carrie can put the contact information where you can file a complaint. Or if you just have any questions, you can call us at the health department. Our number is 706-657-4213. And if we don't have the answer, we'll try to find that for you. Oh, and this is Logan Boss. He's our public information officer at our district, which is in Rome. So he's going to share some information for you guys.
Thank you, Lindsay. It's a pleasure to be here in Dade County today. I enjoy coming up here all the time to do mountain biking over at 5 Points and at Cloudland, but I'm staying away from Cloudland for the time being based on what I was hearing here today. But I'm out of the Northwest Health District, Northwest Health District for the Georgia Department of Public Health. We cover 10 Northwest Georgia counties, among them Dade. And we've been dealing with this coronavirus probably for a month now. We've been lucky in some parts of our district. So far up here in Dade and in Walker, we haven't had any confirmed cases yet. Or in Haralson County down in the southern part of our district. All our other counties have already had cases, some more than others. Bartow's probably our worst hit county because of a situation there with a large gathering at a local church, and there were actually people from a number of surrounding counties who went to this gathering and then became infected and took the virus back to their county. So that's just a reminder that we all need to, while we're practicing, I hate the term social distancing because we need to be, we're all in this together, and it's something that we'll get through together. I've used the term safe physical distancing, and I think that's more appropriate. We are trying to avoid other people and keep that physical space between us, and we certainly want to avoid large crowds or large gatherings. This is kind of a difficult and uncertain and a frightening time, but our job now, everyone's job is to bear what we're all feeling and to take the appropriate actions that we need to be taking to protect our families, our loved ones, our communities, and for many of us, our employees. Many of our Northwest Georgia workplaces, some with large numbers of employees, have had COVID-19 cases. So we want to urge all our businesses and our employers to help prevent and slow the spread of COVID-19 and lower its impact in the workplace by doing really 3 different things. One, that every employer, regardless of size or how many employees he or she has, need to take measures to reduce the possibility of transmission among employees, to maintain healthy business operations, and maintain a healthy work environment. And the best guidance for this is on the CDC website, that if you haven't been looking at it, you really ought to go to that cdc.gov website, click on coronavirus. You can find out more than you ever really wanted to know, but you can find out all the stuff you can do as an individual, as a family member, as a community member, as a member of an organization or a church. and certainly as a business or industry leader in your community to do the things you need to be doing. And again, we're urging all businesses, regardless of their size, to encourage and permit their workers to work at home as much as possible. And we're really asking non-retail businesses, such as manufacturers and construction companies, to ensure that their employees maintain these strict, safe physical distancing measures. And we know that's hard to do, but any business, regardless of size, that can't meet these CDC guidelines really needs to seriously weigh the prudence of remaining open, the prudence against the potential health risks, not only to their employees, but also to the community. And we know there are a lot of serious consequences when an employer thinks about closing a business, and we in public health cannot make that decision for any employee, or any employer, but we ask any business or employer to seriously consider their responsibility to their employees and to their community. If they can't meet those CDC guidelines, which are outlined in detail on that CDC website, if you can't meet those, you really need to take a hard look at how you're doing business and consider whether you should stay open right now or not. Again, I'm not making light of that decision at all. That's a tough decision for any employer to make. The other thing that we're doing right now is we all know that testing for COVID-19 has been hard to find in some areas, but we're bringing more and more testing capability online, and there's been a lot of good news just in the last 48 hours about some new test capabilities that have gotten FDA approval. So we hope to see more and more testing coming online. Right now, through public health, we're offering limited testing to people who meet certain qualifications. And this is not testing that's open to the public right now. We wish it were, but not everybody needs testing. You can have symptoms of COVID-19 and still not need testing. So most people have a mild form of this illness, and they can treat their symptoms at home, and whether they get tested and are shown to be positive or not, it doesn't change that treatment. So we're not testing everyone now. Our very limited specimen collection capability for testing is only for highest risk individuals who are symptomatic, who are sick, who meet specific criteria and have been evaluated by their health care provider, whether that's a primary care physician or a physician at a hospital, and get an ID from public health. These people, once they get their ID, they are directed to one of several test sites. Actually, they're specimen collection sites scattered around northwest Georgia. A couple are in our health district. One is in our neighboring health district to our east. And once you get this ID number, you're directed to the specimen collection site where you're swabbed, and then the specimen is sent off for testing. It's either sent off to the Georgia Public Health Lab or to a private lab. We wish we were getting the results back more quickly than we are. It's still taking, on average, probably 3 to 4 days to get the test results back. We're seeing a decrease in that amount of time. It's still longer than we would like. But that's the process. Now, who are we focusing on to do that? Once again, you have to be symptomatic, and you have to be evaluated by a healthcare provider. So you got to be sick, and you got to see a doctor to be eligible for this very limited testing right now. And the people we're focusing on are high-risk people, those 60 and older, and their caregivers, people who take care of these people 60 and older. We're also focusing on caregivers for people with suppressed immune systems. We're taking care of people who are first responders, and people who would be out, people who might be out in the community if they were sick and didn't know it and could be infecting other people. So these are the high-risk categories that we're focusing on now. So as more and more of this testing capability comes online, we'll be making more and more of that available. But once again, right now we're focusing on people in these high-risk categories. You have to be symptomatic, you have to be sick, you have to be evaluated by a healthcare provider and get an ID number to go to one of these sites and give specimens to be tested. We're not doing the actual testing at these sites. All we do is when people come in, we swab them, we get a specimen collection, then we send that off to one of the state, either the state lab or a private lab for testing. So meanwhile, what can everybody do to help stem the flow of COVID-19 in our community? And I guarantee you it's here in the Dade County community. It's in all our Northwest Georgia communities and has been probably for at least a month and a half. So we've been pretty lucky here in Dade that we haven't had as yet any confirmed cases, but I would be willing to bet you've got cases, people who are sick with this virus here. It's either a very mild form of the virus or they think they've had the flu and just haven't gone to get evaluated. And because of the limited amount of testing that we're doing now, you have no confirmed cases here. But the virus is here, so you need to do those things that our mothers always taught us to do. And I know everyone's tired of being told to wash their hands, but as simple as that sounds, that is still the very single most important way to prevent the spread of this virus. Wash your hands frequently with soap and water. If you don't have soap and water, use a hand sanitizer with 60% alcohol, and avoid touching your face. It's hard to do, but the virus gets into your body when you touch something that has the virus on it, and then you touch your mouth, your nose, your eyes, and the virus will then enter your body that way. So practice not touching your face. That's something that everybody can do on a daily basis to avoid picking up COVID-19. And the other thing is maintain that safe physical distance from other people, especially anyone that looks sick, if they're coughing or sneezing. This is a respiratory illness. It's spread primarily by droplets that are expelled when someone who has the virus coughs or sneezes, and that virus those droplets before they drop to the ground, you might inhale them and get sick that way, or they drop and land on something, and then you come by and touch it, and then touch your face, and you get sick. So if you can avoid doing those things and work at doing that, you can go a long ways toward keeping yourself and your loved ones from getting this virus. And I hope everyone here in Dade can continue to stay very safe and avoid COVID-19. But I'm telling everybody that it's here. We're telling people in Northwest Georgia, we've had over 200 cases in our 10 counties. We're going to have more cases, and sadly, we're going to have more deaths. This is something that's not going to be over in a short amount of time. So the sooner you can get your head around that concept, that this is something we're going to be dealing with, not just for weeks, but in all likelihood months, and possibly even into next year. This is a serious virus, and it's going to be with us for a long time. So the sooner everybody takes these actions that we can all take to prevent it, the better off we'll be in the long run. Thank you.
Chad?
Hello everyone, I'm Chad Payne. I'm the Public Information Officer for the Dade County Sheriff's Office. Just a few things to touch on. Not a lot's changed as far as how we're operating since this started, but I just wanted to give a few reminders. The access to the inside of the Sheriff's Office has been limited to personnel only. And what that means is that background checks, fingerprints, things of that nature are not being done currently. as well as I believe VIN verifications like that for tags. We're not doing those right now, and we're trying to answer a lot of those things, a lot of those calls by phone. So if you need something from the Sheriff's Office, you're welcome to call us. The number is 706-657-3233. And also, something that we're trying to push that makes it easier on us and everybody else, if you have the option, is to email us at info@dadesheriff.com. And what that'll do is if you need a report or if you need pretty much any information on inmates, anything like that, you can email that and we will get back to you. And we can email reports, we can fax, we can do pretty much all that kind of stuff that's needed. Something else that I want to touch on that it's been picking up, which is what we're wanting and we're pretty glad about it, is our grocery and medication delivery that we're doing. And for some of you that don't know what that is, that's just us our way of trying to help vulnerable or at-risk people. So far it's mostly been elderly, and we have helped somebody that was just young and had some very young children that they didn't want to get out. So we were able to help them that way. If you need information on that, then you can contact the Sheriff's Office or that email that I gave, or you can contact my work number at 706-944-3329, and that will get you to me, and I'm doing all the coordinating for that, so we can get you set up and get you taken care of if you just need more information. Also, if you need to do anything with inmates as far as putting money on books, there's a kiosk inside the Sheriff's Office. Well, since Sheriff's Office access is limited right now, you'll have to go online to www.jailatm.com, and you can put money on their books or do whatever you need to for phone calls and video visitation through that online website. Something else I wanted to mention was here lately we've had, during times like this, it either brings out the worst in people or the best in people. And so far we're seeing a lot of the best in people. And we've had some people come by and bring us these masks. And while they're not something that's going to do 100% good, they are better. They're a layer of protection between us and somebody's sputum or something like that, their spit. So you may see some of the offers wearing these. Samantha Clark and her mother made us about 50 of these and brought them to the Sheriff's Office today. I'll be posting about that on our Facebook page later. So if you want to see more information about that, follow us on our Facebook page. It's Dade Sheriff. And also we had another citizen that donated some respirators, some throwaway respirators, donated them to the jail. And we've had more masks donated by other people. So that's the best in people. Now the worst in people is, I want to remind you about scams. I saw where there's also a new scam going out to where people are sending checks to individuals and they're masking those as the stimulus checks that are new. Just do me a favor and yourself a favor and your neighbors a favor. Some people don't see these Facebook feeds, but you see them and you can talk to somebody and you can tell these elderly neighbors who don't have Facebook, family members, things like that, watch for these scams. Don't fall for stuff like that. The scams with people going door to door saying they're going to test for COVID-19, that's not going to happen. I'm not going to say it would never happen, but it's not happening right now. So do not pay people to do those tests, and do not cash these checks that are fraudulent that are coming. That's the way to gain access to your checking account. So that's the worst in people, but we want to focus on the best in people. Just remind everyone that especially the elderly or people who don't have Facebook, not to fall for those types of scams because they're out there. And that's pretty much all I've got. Thank you. And again, info@dadesheriff.com. If you have any inquiries into the Sheriff's Office, we'll get back to you.
Yes, sir.
Hello. Haven't seen me much lately. I've been kind of quarantining myself, but I do have some information. Of course, we were hoping to be open the 1st, and we will not. We don't have a date yet, but we're just going to say the library's going to be closed until further notice. If you have books checked out, don't worry about it. We will not be accruing any fines, movies, DVDs. You're welcome to keep those. They won't be accruing any fines until we're open back up. We also are opening up our digital services. If you do not have a library card and you wish to have access to our digital services, if you will please go to our website, which is chrl.org, and there is a place where you can fill out for a Pines card. We're going to be checking that daily. I'll go in, and if you filled out, I'll give you a phone call and get a little bit more information for you, and I will give you a library card number. With this card, you'll be able to get magazines, ebooks, audiobooks. You'll have access to ancestral, resume writing, job application things, all kinds of different learning tools on that website that you'll have access to. So if you are interested in that, please go to our website and fill out that. You can go on our Facebook page too also, and we'll be giving more information about that. I think that's all I have today, but we miss y'all. And as soon as we get back up, but email us. If you need to know anything, email us. It's Dade, CIRC, @chrl.org. We're checking that daily, and we're emailing people back. We're actually getting emails from people, and we're emailing them back, kind of letting them know what's going on. So, and if I have any more updates, I'll come back. But we miss y'all.
Appreciate all y'all being here today, and good update here. Just you know, if you have any questions, don't be bashful. Call us here. Go online, and you can email Carrie, and we'll get right back to you. My number is 423-667-8999. And Carrie, have you got anything that we've left out we might need to mention? Okay. All right, we'll be back here tomorrow at 3 o'clock, and hopefully we'll be bringing you some good news. I keep saying that, and hopefully this thing's got to change. And just appreciate everyone out there working with us on this, because we've had a lot of people, a lot of positive people here that are really stepping up, and they're doing their part, you know, and we just want to do our part as a government. So just we'll talk to you tomorrow at 3 o'clock, and thank everyone for tuning in.